Hello everyone, and welcome to this week's video on patient positioning. We're going to do it in the bed today. So the first position we're going to do is when the patient's lying supine. This is when the patient is lying on their back. So some bony prominences that you want to keep in mind to prevent some pressure injuries are their occiput, their spine of their scapulas, their inferior angles of their scapulas, the vertebral spinous processes, the medial epicondyle of your humerus, and then your posterior iliac crest, your sacrum, your coccyx, and the heels of your feet. And then you want to place a small pillow or cervical roll underneath their head. And then you want to place a small pillow or roll towel behind their knees and a small rolled towel underneath their ankles. So we're going to use one pillow for this since it spans from her knees to her posterior ankles. And then finally you want to put their arms in a position that is comfortable for the patient. And remember that you always want to make sure that if you are moving any of their body and their limbs or extremities, when you're putting pillows underneath them, you want to make sure you want to support them. And that is it for the supine position. Now, for the second position that we'll be doing, the patient will be prone, which is them lying on their stomach. So some bony prominences that we'll keep in mind for this position is your forehead, their anterior portion of their acromion process, the anterior head of your humerus, your sternum, the anterior superior iliac spine, your patella, and the dorsum of their feet. And so first you want to place a small pillow or rolled towel underneath their head, or you can also use a special headrest that has a hole in it. There's also tables that have them like that. Secondly, you want to place a pillow under their lower abdomen, and then you want to position their head either to the left or to the right. Just pick a side, whichever they're comfortable with. And then you want to place a rolled towel, or you can use a pillow under each of their anterior shoulders, but in this case the pillow is large enough so it covers their shoulders as well. And then you can place pillows or a towel rolled up or a small bolster underneath the anterior ankles, and then you can position their arms comfortably however they want. It can be above their head, or it can just be straight back. And then you always want to remember that anytime you're moving them or their extremities, you want to support them at all times. And that is it for the prone position. Now for our third position, it is our side-lying position, which can be on the patient's left or their right. And the first bony prominences that we'll be going over to prevent pressure injuries are your ear, their lateral portion of their acromion process, the lateral epicondyle of their humerus, their greater trochanter of their femur, the head of their fibula, the lateral and medial malleoli at their ankles. And so first we're going to initially position the patient in the center of the supporting surface so that they have enough room to roll on either side. And then you want to flex their hips as well as their knees. You want to support their uppermost leg with 1 to 2 pillows and place them slightly forward. And you want to place a pillow just proximal to their lowermost lateral malleoli. And you want to support their head with 1 to 2 pillows, depending on their thickness. You place a folded pillow at the patient's chest, and then you put their arm on top of it. And any additional pillows may be necessary for the patient's comfort as well as their protection. And then anytime you're moving their body or their extremities, you always want to remember that you are supporting them in whatever you're doing. And that is it for today's video on patient positioning. We covered prone, supine, and side lying. Thank you for watching. See you next time.